Hi guys, I'm Christine. I'm the dental therapist that works here at Metamorphosis Orthodontics, and we're here today to talk about how to look after your teeth because it's World Oral Health Day. Now when you're brushing your teeth, you need to make sure that you're brushing right where the gum and the teeth meet. The reason being is plaque always builds up right where the gum and the teeth meet. Okay, so you need to brush 2 teeth at a time for 5 seconds before moving on. But you need to make sure that you're brushing the biting surfaces and also the insides as well. So 2 teeth at a time for 5 seconds. With an electric toothbrush, if you have one that rotates, you do 1 tooth at a time. The common mistake is most people tend to turn it on and move it around very quickly, which ends up not brushing away any of the plaque bacteria and traumatizing the gums as well. So 1 tooth at a time, again, right where the gum and the teeth meet before moving on. And again, make sure you're brushing the biting surfaces and the insides. There are other electric toothbrushes on the market that don't have the rotatory head. Again, you have to make sure that you're brushing away all the plaque away from the gum lines as well, okay? Now cleaning in between your teeth is just as important. A lot of people don't end up flossing or using any forms of interdental aids. You need to make sure that when you're flossing, not to do the conventional sawing motion. That doesn't get rid of any plaque bacteria at all. What you have to do is wrap it around like a C shape around one side of one tooth, right under the gums, and what you want to do is bring it up and down rather than a sawing motion, and make sure you do the other side of the other tooth again, an up and down motion. You'll notice that the floss will actually go under the gums and that will lift away all that plaque bacteria. Don't be worried if it does bleed because it's going to bleed before it gets better, okay? Usually takes about 2 weeks. Now, if you don't like floss, sometimes they have little incidental aids with bristles. What you have to do is make sure you just bring it in between the teeth, right on the gum line, just so you're really removing all that plaque along and away from the gums.